Hi, everyone. Welcome to this week's ISR-CPIS Joint Seminar Series on Resilient Pacific. I'm really pleased today to have Anita Hofschneider here talking about Hawaii COVID-19 pandemic disparities, a discussion of the challenges and resiliency of Pacific Islander communities. Before I turn this over to Anita, though, I just wanted to thank my colleagues and collaborators, Tarcisius Kabutalaka, the director of the Center for Pacific Island Studies, James Viernes with CPIS, and Aida Eric with the Institute for Sustainability and Resilience. For really helping out and putting this series together. I want to remind everybody that this webinar is recorded. We can only see the speaker and the organizers in the recording though, so it'll be posted on the CPIS YouTube channel as well as the ISR website for later viewing. And when we get to the Q&A period, if you can please type in your questions into the Q&A box rather than the chat, it kind of makes it easier for us to see it all in one place. So with that, I want to introduce Anita. She's a staff writer at Honolulu Civil Beat, where she covers social issues. Her writing has also appeared in the Wall Street Journal, the Associated Press, and The Guardian. She was a 2020 National Fellow for the Center of Health Journalism at the University of Southern California. And this fellowship enabled her to focus her reporting in 2020 and through the pandemic, really on its racial and ethnic disparities in Hawaii. And this is what she'll be talking about. So Anita, I'll turn it over to you.
Thank you so much for having me. I'm going to be sharing my screen to share this presentation I've created. So if you just bear with me one moment. Can you see that? Oh, I guess I can't see you now, but
hopefully you can see it. If you can just put it into presenter view. Right now we can see it in, there we go.
Great, thank you. Wonderful. Well, thank you so much for having me today. You know, it's such an honor to be here speaking to the Center for Pacific Island Studies on the reporting I've done about Pacific Islanders in Hawaii as a Pacific Islander in Hawaii. And, you know, since I don't often get this opportunity to be talking to a community of Pacific Islanders, I wanted to introduce myself in a way that's cultural to as a Chamorro. For Chamorros often introduce themselves in relation to their families and their islands. So I'll say, Guahu Anita Hofschneider, Tau Tau Saipan, Hagen James Hofschneider, Ginen Tinian, Zan Penny Badadzu, Ginen Guahan, Mafanyaguzu, Giza Saipan lo Pagus Masagazu, Giza Hawaii sa Matututudzu, Giz Civil Beat. Undang na sijus maasi para estina oportunidad. I am really honored to be here today. And as McKenna mentioned, my presentation today is about pandemic disparities. And what I'll be talking about today is kind of answering these questions. You know, first, I'll spend most of the talk focusing on what the situation in Hawaii was like for Pacific Islanders prior to the pandemic. And, you know, Pacific Islanders is a really diverse community, as you all know. It's really broad. And so a lot of what I'll be focusing on will focus on COFA migrants, people whose legal status is from the Federated States of Micronesia, Marshall Islands, or the Republic of Palau. And part of this is because this is where I've done the bulk of reporting, but also it's because state data has indicated that people of Chuukese and Marshallese ancestry have been hit hardest by the virus here. And then I'll go into what the first 6 months of the pandemic were like for these communities and what's changed since then. And I know what are some of the ongoing issues. Just some caveats before we get started. I'm used to, writing out my articles and really laboring over how I'm phrasing things. And so speaking in this manner is kind of a new experience for me. And so I encourage you to send any feedback to my email address up here, and know that this is an exhaustive talk. And I'm also, if there are any errors, then they're mine alone, and I'm happy to correct them. So thank you. So my first part of this talk will be focused on what was the situation like for Pacific Islanders in Hawaii prior to the pandemic, because I think that understanding this context is really, really important. When you look at the disparities, and we've reported on them, for those who don't know, Pacific Islanders make up an estimated 4% of the population, and this is non-Hawaiian Pacific Islanders, so people who are Samoan ancestry, Marshallese ancestry, basically Melanesian, Micronesian, and Polynesian ancestry who aren't Native Hawaiian. They make up about 4% of the population, but they make up currently about a quarter of COVID-19 cases. And at one point it was as high as almost a third of cases here. And I think in order to understand this major disparity, you need to understand what the context was like before the pandemic. And so I'll be talking about the growing body of research showing how there are severe health needs in these communities, how there was a stripping away of access to Medicaid, which is low-income health insurance, at both the federal level and at the state level. And there was also a growing body of research about discrimination and implicit bias against Micronesians in Hawaii, including in healthcare settings, and as well as data showing that Hawaii is home to significant social inequities, particularly affecting Pacific Islanders. I really wanted to start with this, laying out this data, because I think that that's something that a lot of people may not necessarily realize. And I wanted to cite in particular a 2018 state study that analyzed census data from 2015 and really highlighted striking disparities in housing and income. And so, for example, if you take a look at this table that I pulled from the report, it showed, poverty by race group. And so the total population, the poverty rate for all families was 7.7% and 11.2% for all people. And if you can see, for Pacific Island communities, their disparities are quite significant here. So for example, Native Hawaiian families have a poverty rate exceeding 12% and 15% for all people. And Tongan communities, their poverty rate for all families was 21% for all families and 16% for all people. For a Marshallese community in particular, it was 46% and 51%. So very, very significant. You can also see that here with the per capita income by group. If you look at these ethnicities, it really stuck out to me that so many Pacific Islanders were, so far below the total population per capita income. There was also disparity in terms of homeownership, and this is important, especially regarding maintaining of housing. So, whereas the total population, more than half the population, on average, are homeowners, that really isn't the case for Samoans, Marshallese, Tongans, and other communities. And I also wanted to highlight household occupancy, because this was something that really came into importance, with the COVID-19 pandemic, was understanding how easily the virus spread in households that were overcrowded, where a lot of people lived. And so if you look at the total population, Hawaii actually has a relatively high household size compared to other states to begin with. And so having more than 3 people on average in an owner-occupied household is already considered relatively high. But if you look for Pacific Islander communities, the Tongan community had, on average 8.31 people in an owner-occupied space. And then if you look for the Marshallese communities, it was 16.45, which really struck me. I would also say that, there are a lot of ethnicities that are missing from this, and I've written about that as well. So there's still, a lot here that we don't know. But when I talk to, people, for example, in the Turquoise community, they will tell me that they'll look at the Marshallese numbers and kind of wonder if their community's numbers would be similar based on just what they know anecdotally. Also, before COVID, we knew that Pacific Islander communities, particularly Micronesians, were struggling with health issues. And so people who are familiar with the history of the Pacific will, be familiar with the nuclear testing in the Marshall Islands, with the challenges of obesity and diabetes and non-communicable diseases, and also, different life expectancy rates, and which is a big reason why people come here to begin with, is to be in a place where they can find jobs and get education and also have access to medical care that isn't available at home. And so there was an interesting study in 2016 about that kind of compared Micronesians to other communities and found that, effectively Micronesians get sick younger than other communities and hospitalized at higher rates for cancer and endocrine issues. So this was in 2016. And, I haven't found great Hawaii-specific life expectancy data, but I did find this study from 2017 that talked about disparities. And I just wanted to highlight this because even though Micronesians or non-Hawaiian Pacific Islanders are not included in this, you can see there's a huge disparity already between people of Chinese or Japanese descent in Hawaii and people of Native Hawaiian descent. And so given what we know from the previous study, that really stuck out at me as significant. And so another key part of the context before COVID-19 hit was access to Medicaid. And so back in 1996, federal COFA migrants became ineligible for federal Medicaid. And Hawaii at first continued to fund this. But it wasn't just, the change in 1996 was part of sort of a broad-based reform that also cut off Medicaid access for other immigrants who weren't, green card holders. And Hawaii at first decided to continue to fund this group under the Cayetano administration. But over time, the growing costs and the lack of federal funding became a real political issue. And so in 2009, the Lingle administration kicked citizens of COFA nations off of MedQuest and onto a new, more limited health insurance plan called Basic Health Hawaii. And I just wanted to share a video clip of a documentary that was done where the community talked about what impact this had on them.
I know for a fact that not all the medication that he gets will be covered because they're through the Basic Health Hawaii, they're only given for, medication. The services that he's given with the handy fan that takes them from one place to another, or to take them to their treatment, will be taken away. We cannot afford it. So if this get kicked in, we're gonna be planning a funeral for my father. Because for sure, he already said that this is a death sentence for him. And with most families, that is a fact, and it is the truth. They will plan a funeral for their families that are covered under that help, because there won't just be anything.
The fears of dying because of the lack of medical services have become reality for some. Families have already faced the death of loved ones and believe that denial of medical services contributed directly to their deaths.
When we talk about the consequences of Basic Health Hawaii, BHH, there were several unfortunate, rather tragic consequences that transpired. The people who put this in play automatically started changing people's plans, changing things over without, the final chapter in place that said this is going forward, and there wasn't enough explanation and so forth. So when people came to their physicians to get particular services, all of a sudden they were being denied certain things.
We have friends who are on dialysis who didn't get all of their dialysis treatments, and so they got very ill. We do have a family member who was diagnosed with cancer, was taken to the ER. They already heard about the BHH, being cut, and so they didn't proceed with doing, anything immediately because they were afraid that they wouldn't get paid. But eventually, the lady passed away.
Cancer. Iwe, ano company, ko kanangia sa tranutongani. Ipotranangan. Ran ngane pala forced to resign. Iwe ngayon yung mga ano insurance, ano company. Well, you put force ni ano pala resign, sa ano. When sa ano qualifying ano po insurance. Kaya lang sa tranutongani. Apana plaga de ano po ano yung insurance at satu Midwest.
The reason I wanted to kind of share that was because I thought it was important to understand that, when we talk about the state of Department of Health today under the pandemic, trying to really connect with these communities, gain their trust, try to convince them to take vaccines, communicate where testing is. I think it's really important to understand that history that back in 2009, the way in which the trust for a lot of families was broken with the more limited health insurance. And so that was effectively stopped by a lawsuit. And I'll get into, what happened next a little bit later. But first I wanted to switch gears a little bit and talk about the, concurrently to all of this, there were more and more reports and research coming out about discrimination against micronations in Hawaii. So I did a story about a Palauan woman who moved here and, back in 2001, so 20 years ago, and was, told, don't tell anyone that you're Micronesian. And so 10 years ago, my colleague, Chad Blair, did a story about a really well-known Micronesian activist who talked about her experience. She's both Polynesian and Micronesian, but when she dresses like a Micronesian, she feels like she is treated differently, including, changes in voice tone in the doctor's office, nurses not holding a door open for her. So even in healthcare settings, she's experiencing this prejudice. There was also a really interesting study in 2015 from UH where it analyzed implicit bias and found that negative stereotypes against Micronesians were pretty strong in Hawaii residents, especially when compared with, the slightly negative stereotypes that non-Hawaii residents held. And there were positive implicit biases towards Japanese Americans here. There was also a study in 2019 about, 1 in 4 Micronesians say they face prejudice at work, overhearing comments like, oh, cockroaches, or I hate Micronesians. And so just how common this is for this community. And another study about, particularly in healthcare settings for Turkish patients who report that they often encounter discrimination. And, around this time, what kind of messaging is coming out from Hawaii political leaders? So in 2011, my colleague Chad Blair wrote about how the federal delegation wrote a letter to the US government urging them to create basically screening measures that would reduce the number of migrants who are coming to Hawaii who were likely to become a public charge. And this was in the context of people coming here for diabetes care. And so Governor Abercrombie was somebody I interviewed. This interview was more recently, but when he was talking about his decision to appeal a lawsuit to allow, the state to limit what kind of basically push COFA migrants off of MedQuest, he was explaining his reasoning, and he said, every dollar that goes to provide services for a compact migrant is a dollar that cannot go for a preschool or for building affordable housing for our people. So what ended up happening was that after the state prevailed legally, the Ige administration decided to move COFA migrants off of MedQuest, and in order to save the state money. And they did it, much more smoothly than the Lingle administration had. Instead of that abrupt cutting off of care that had happened with Basic Health Hawaii, they immediately transferred people onto what would become the federal marketplace. And they maintained coverage for people who were elderly or who qualified as blind and disabled. And the idea was, if you're between 18 and 64 and, you wouldn't be able to get access to Medicaid. But if you were, somebody who was like a kupuna, then you would be able to. And so this, sounded better than Basic Health Hawaii, but it was also proven confusing for people to sign up for it and more expensive. I interviewed this man here, Carlos, in 2019, who talked about how even with subsidies he was getting for his Obamacare insurance, he was just really struggling to afford his medical bills and was racking up medical bills. Because if he had been a US citizen or been a US national or been a green card holder who was eligible for Medicaid, he would have been considered in the lower income bracket where he wouldn't have had to pay, that extra premium. And so what this kind of translated into a higher uninsured rate for COFA migrants. And unfortunately, I don't know what the uninsured rate was for them previously. I got this from a report that said that between analyzing data between 2013 and 2017, the uninsured rate was 14%. And this is significant because in Hawaii as a whole, the uninsured rate is generally around 4%. So there's already this major disparity in terms of access to healthcare. And then there was a study that came out last year that found that this pushing micronations off of MedQuest and onto Obamacare effectively created about additional 24 deaths per year that these University of Hawaii researchers said they believed wouldn't happen if that policy change hadn't happened. And so, correlation is not causation, and that's what the state officials had told me when I presented this study to them. At the same time, Medicaid is something that's known to save lives, and other studies have shown how Medicaid can save lives. And so, and then that was the biggest kind of factor or the biggest kind of change for this community in terms of healthcare at this time. And so researchers who I interviewed from UH strongly believe that this is what led to this sharp increase in mortality. I thought this quote from Neil Palafox, a physician, was really interesting because when I wrote about the mortality study last year, he was saying how he doesn't think anything's going to change until people in Hawaii push it. A lot of them don't feel like that this vulnerable population is important or it's not their priority. At the same time, under the Ige administration, the Ige administration also defunded the Office of Health Equity. And so the Office of Health Equity was really small, and they didn't, so I don't want to overemphasize what they did. They didn't, they were like a one person office effectively. So, but the reason I thought it was important to highlight this was because of the reasoning why they did that. And I spoke with someone at the state who said that they felt that the conversations about access to healthcare on the mainland weren't as relevant to Hawaii because Hawaii is a minority majority state with a relatively low rate of uninsured people. And clearly there are levels of institutionalized racism here, but it is so stark on the mainland, he said. And I thought that was really interesting because I do think the fact that Hawaii is a minority majority state colors the conversation that we have about the really, really stark disparities we see in the data. He also said, when people talk about COFA, they talk about how much it costs. This is where the conversation just kind of simmers. It's really all people talk about. The COFA conversation is about how many general funds we're spending and not about solving the problem being access to healthcare. So this was the context in which, the pandemic hit. And so to me, I thought this was really important. And I'm spending most of my talk on that context, but I thought it was really important because once I understood all of that, I felt like what happened in the first 6 months of the pandemic actually made a lot of sense. At first, the data wasn't disaggregated. State officials were downplaying potential pandemic disparities. And this is where kind of the resiliency comes in. The community members and service providers really sprung into action. And I also wanted to highlight that the pandemic's impact went beyond the virus itself. Here are some examples of kind of policymaker statements at the beginning of the pandemic. Bruce Anderson, who was leading Department of Health, said in April in response to a question I asked at a press conference, I think everyone is pretty much in the same socioeconomic group, except perhaps some of the Native Hawaiians and Pacific Islanders. And it's clear from the data and the state report that had come out years before this that that's not true. And also, you know, this Pacific Islander advocates met with Sarah Park, who was leading the response at that time. And, you know, they felt as though she wasn't willing to really listen to them or incorporate their suggestions. And America Caldwell ended up acknowledging, you know, in some ways, I think we forgot about this community. So what that meant was that the community really galvanized into action. When I talk to people and across communities, you know, not just COFA communities, but the Samoan community, the Native Hawaiian community, all different Pacific communities were really responding to the needs in their communities. For a lot of people, this meant, you know, driving around, delivering food, delivering medicine, helping people figure out where to quarantine. You know, in some cases, people, like one man I heard about was sleeping in his car because he was afraid of making his children sick because it wasn't clear about having access to hotel rooms or other places to quarantine if you needed to. They were translating different guidance. They were getting guidance from other states. And they were really just trying to do everything they could to triage what was happening with their communities and make sure that, you know, what happened in Hawaii wasn't as devastating as it could be. And I think this was also really challenging for people because of the multifaceted aspect of the pandemic. And the pandemic wasn't just the virus itself and people getting sick and dying and being hospitalized from it. It was also, you know, an economic pandemic. And so, for example, COFA migrants really struggled to access unemployment. Everybody in Hawaii, everybody struggled to access unemployment. But this was particularly difficult for COFA migrants because when the state created a workaround for its unemployment applications, they excluded the legal status of COFA migrants. So you were trying to sign into this web form and it didn't have a way for you to indicate the number showing that you were, you know, legally employed. At the same time, there was such a huge increase in enforcement of the stay-at-home orders. And I know that this also similarly affected everybody in the community. I feel like I know so many people who got cited during this time, but there was a really interesting article from Hawaii Public Radio that highlighted like very, very significant racial disparities where something like a quarter of the arrests were for Micronesians who make up 1% of Hawaii's population. And 8% I think were Samoan. So, and then the Black community also experienced a disparity. So it was Micronesians, Samoans, and Black people who were experiencing this like over policing at that time. At the same time, you know, as there's widespread unemployment, people are flocking to MedQuest to sign up. There's a huge, you know, skyrocketing in MedQuest applications, but because of everything we talked about before with the stripping away of MedQuest access for this community, people who are unemployed, you know, were not able to access that. And therefore, this community that was getting, you know, hardest hit by the virus was also not eligible for health insurance through MedQuest during a pandemic. And there was also the issue of, you know, losing housing despite the eviction moratorium. I wrote in particular about a Marshallese man who, you know, had been keeping his family afloat with his $12 per hour wage, but when the pandemic hit, he lost a bunch of hours and felt pressured to leave. And so what ended up happening was that he ended up moving in with friends and family, and now they live tripled up in a 2-bedroom apartment. And so that contributes to the overcrowding that was already existing prior to the pandemic. So part 3 of my talk I wanted to be was about sort of what's changed since then, because the first 6 months about the pandemic were really, really difficult, I think, for a lot of people, and really forced community organizations to step up and lobby. And one thing that also came out of it was partnerships between different Pacific Islander communities. So Native Hawaiian leaders banded with Samoan leaders, banded with Micronesian leaders, really trying to make sure that their voices were heard at the state level. And now there's a lot that's actually changed. So last fall, Department of Health established a Pacific Islander contact tracing team. And the city and county of Honolulu also established a Pacific Islander liaison position. Mayor Caldwell told me that that's the first Pacific Islander that he had ever hired on his staff. There is also an influx of city and federal funding for We Are Oceania, a service organization that's mainly serves Micronesians, but has expanded to serve other communities. And there's also funding from the Department of Interior. And the biggest change that I want to highlight is the restoration of Medicaid access. So this very difficult, fraught political issue for so many years was effectively resolved with the restoration of Medicaid access for this community. So now the community is able to sign up for Medicaid. But that doesn't mean that there aren't continuing issues. So, one of the issues that continues is access to vaccines, and we don't really have any data. I've been asking for a racial breakdown or ethnic breakdown of data, and it's unclear, when we will know, whether the communities that have the highest rates of COVID are going to get access for vaccines. I know that they're working on it. It's definitely not as simple as just handing over the data. But it is something that is, a continuing question, because there are concerns from advocates that, their community isn't getting access to the vaccines or not getting enough access. There's also, border closures. I wrote a little bit about how it's been difficult for islanders who were, in the States for whatever reason, and then haven't been able to return home since, and struggled economically or struggled with the inability to bring home their loved ones who have passed away and bury them traditionally. And this is something that's continued, especially while some people from American Samoa and the Marshall Islands have been repatriated. The border closures continue for people from the Federated States of Micronesia. And finally, Medicaid restoration is really a huge step, but it doesn't really solve that question of access to healthcare. As one of my articles, I interviewed Dr. Palafox, and he had said that, patients continue to face language barriers, cultural barriers, and bias from healthcare providers, or they would continue to face this if Medicaid were restored. I wrote this before it was restored. And, it's important to think, when we talk about disparities elsewhere, the Native Hawaiian community and its healthcare disparities, they have had access to Medicaid, and yet they have advocates for that community have talked about the continuing struggles to get quality health care. On the mainland, people who are African American or Latino might have access to Medicaid, but they still suffer from disparities. So Medicaid doesn't necessarily solve all of these issues, although of course it definitely helps. And the other thing I thought was interesting was how he pointed out that this pandemic might help people in Hawaii realize that the health of this community matters, even if they haven't been a political priority, even if we've said, moving the money to other things in the general fund are more important than providing healthcare to this community. That actually has significance, because if you are, all of that kind of back and forth, yanking healthcare, limiting it, changing it, it kind of undermines people's trust in the system and may make them less likely to seek care or testing. They might be more afraid of getting hit with a big bill. And during a big pandemic, then that really matters. He said, if you have one segment of the population that doesn't have good health care, it affects everybody. And I wanted to end on this quote from Dr. Alec. He told me in one of my articles, we are not just bystanders. We took the initiative to really help our people. That's something we're really proud of. We took matters into our own hands. And I think, thinking about this quote, as well as, the list of all the people who are now in leadership positions or in the state helping to respond to the pandemic over the last 6 months, or leadership positions in the private sector who are responding, it really highlights that people from Pacific Islander communities want to be seen as resources and not victims. They, when I interview them, they want me to highlight these disparities, but they also want me to show that what they want is for to be included in these decisions, to be part of them. And I think that is when we talk about, resiliency of Pacific Islander communities, it's really about, despite all of these different challenges of access to healthcare and despite challenges of discrimination, the way in which these communities have continued to, do what they can to move forward and to help one another, and also to band together and to help across Pacific communities. And so one thing I actually forgot to mention was just the forming of all these task forces in the wake of the pandemic. There was a national NHPI task force, so many different local task forces, statewide ones for particular communities, people just kind of self-organizing and using Zoom and using Facebook and going door to door to people's houses to explain why, you shouldn't hold a big funeral during this time, or to explain, how to kind of marry Pacific Islander customs with the realities and dangers of the pandemic. And there's just so many people who took that upon themselves to do that. And so, although I often write about kind of the way in which public officials have fallen short, or the way, sort of in a manner of which I'm sort of focusing on the deficits and hoping to hold people in power accountable, I also don't want that to minimize the work that's being done on the ground and the work that's being done by the communities themselves. So thank you so much. I think that's all, and I'm totally happy to take questions.
Thank you, Anita. That was a great talk, and McKenna is actually having connectivity issues, so I'll jump in and facilitate the questions. For anyone who's connected, if you could put in your questions in the Q&A function, we'll monitor that. But I just wanted to read a comment that was put in the chat by Julie Walsh. Not a question, but just to say, Abercrombie met with Micronesian community leaders to explain that he would end BHH and spread budget cuts across populations rather than targeting them. Then he tried to explain his rationale for challenging the case, which ultimately went to Supreme Court. He tried to justify the case as necessary because it was being watched by states with immigrant populations as setting precedent. It was an interesting event, just sharing. So that's quite, the precedent is, how do you set precedent with people's lives anyway?
Thank you, Julie, for sharing that. I didn't know that, and I started at Civil Beat as an intern in 2012 and then full time in 2013. So all of that happened kind of before I started covering this issue. And I honestly have never really covered healthcare until the pandemic hit. I had like maybe 2 stories I'd written about healthcare prior to that. So it's all been really new. But I do think that that history is something that people bring up a lot. And so it's really important.
Yeah, so we have a question from Thomas Manglona. What can other states with Pacific Islander populations learn from what is happening in Hawaii to better support the residents?
Actually, that's a good question, Tomas. Thank you. I actually think that there's a lot that Hawaii can learn from other states. So one of the articles I wrote focused on Oregon and the way in which the state of Oregon had already been kind of reaching out to Pacific Islander communities in a really organized way before it felt like before Hawaii did, although I don't have the exact timeline. For example, because they had a lot of people who had equity as part of their jobs, like in the governor's office and in the health department and in the state and county levels as a whole. There were people who, as soon as they saw the disparities, were reaching out to different leaders in the community and trying to figure out how can they get funding to them for Pacific Islander contact tracers. And so that happened much more quickly in Oregon than it did in Hawaii. And so I know that, in the last 6 months, there's been a lot more focus on equity at the Department of Health here. It's something that comes up a lot in, public hearings and conversations. But I think that, one kind of question I have or will continue to look at is, are there people who, paying attention to equity is like a really key part of their job? Because what I was hearing when I was reporting on that issue was that people wanted to, it was difficult if you didn't have anybody in particular to hold accountable who was responsible for making sure that your community was included. It was difficult to make sure that you were holding them accountable.
Right, and then following up on that with Tomas's question, what are some of the issues with the way current data is being collected that makes it hard to report on accurately?
A lot of issues with data. I mean, I'm talking about disparities and, I'm talking about disparities and I keep trying to cite data because I think that's really important. But I would say the caveat with all of this data is that the way that it's collected is I think challenging. Even census data, what is the sample size if you're speaking to people who identify as Chuukese or Marshallese or Palauan? When it comes to COVID-19 data, I looked at every single health department's COVID data in May, and for every state and every territory. And I found a lot of places were not collecting data for Native Hawaiians and other Pacific Islanders, or they were calling it different things. And so the official federal term is Native Hawaiian and other Pacific Islanders for that race category. But some people kind of put them under Asian Americans or put them under Asian Americans or didn't include them at all. And that, they might have been justified because of the numbers, I'm not sure. But there was just definitely a lot of missing data. And then because of that terminology, NHPI or NHOPI, it kind of implies that Hawaiians are experiencing a disparity. So when I was reporting on disparities in Hawaii before everything was disaggregated, I had, as a headline, Hawaiians, other Pacific Islanders experience COVID-19 disparities. But once it was disaggregated, that wasn't true, that Hawaiians hadn't been experiencing a disparity. And so I felt responsible for contributing to this misinformation, even though it was an honest mistake. Just the way that NHPI is as a category kind of implies that. And at the same time, if you look at other states, like for example, Arkansas, they had the NHPI category, but a lot of their cases were really in the Marshallese community. And so I think it's important, if you're somebody who's looking at this data or reporting on it, to just be mindful of that just because it's NHPI doesn't necessarily mean that the disparity exists in the Hawaiian community, which is really surprising because it's such a big community and you would expect there to be a sameness there.
Yeah, a lot of good questions coming in. Who are some Pacific Islander community leaders / health experts that you have met who you feel is making a difference in addressing the issues you are bringing up? Was there a memorable or impactful interview during your research?
There's so many. I can't name just one. And I couldn't name them all. But I think that there's just a lot of people who are making a difference, a lot of people who are helping in whatever way that they can. And there have been so many different memorable interviews. I mean, I would say one of the stories I didn't really talk about today, but is related to the border closures. And I spent a lot of time with a Pohnpeian family who hasn't been able to bury their mother who died on April 1st of last year, and they're determined to bring her back to Pohnpei and give her a traditional funeral. And so kind of sitting with them in their grief and meeting with them and learning about her life and learning about Pohnpeian burial traditions was extremely meaningful, and it just felt like such an honor. So I would encourage people to read that story if they're interested, because I felt like their story was so moving, and it was emblematic about the way that Pacific Islander cultures have had to change during this time.
Yeah, I remember reading that in Civil Beat. And maybe following up on that, for people who aren't as connected with these communities, what can we do to support the leaders who are making impactful changes on this? Do you have any recommendations there?
I'll have to think about that.
Okay.
Yeah.
All right, here's a question. Who is interpreting for the Chuukese and Marshallese speaking communities? Is there a training pipeline to ensure that there are a sufficient number of individuals trained to do this work effectively and ethically?
So I can find a list of interpreters. For anyone who's looking for an interpreter, We Are Oceania has a list online of people who speak Chuukese, Marshallese, and other Pacific languages. I know that they're in demand. So we actually translated a couple of articles into Chuukese, Marshallese, and Tagalog. And it's been interesting to kind of get the perspective of what it's like to be someone trying to get these translations out. Usually I write about lack of language access, but in this case, I was writing about, I was trying to provide the language access myself. And I appreciate it is challenging because the interpreters are in demand, and especially now. I think that I've heard that there needs to be a better pipeline for interpreters, but I don't know very much about that. It is something that I would like to report on. So if anyone is interested in speaking with me about that, I think that, that pipeline it would be a really important area to write about.
Yeah, ask for leads in this. That's great. Another question from Keola Diaz. One of the challenges that I regret not being able to research is the revenue generated by working Micronesians in Hawaii. The general argument that taxpayers carry the burden of social services for Micronesians can be refuted in part by the amount of taxes collected versus the cost of social services that Micronesians do not qualify for despite contributing to the general tax base. Is there data that focuses on that?
So I actually found a report from early last year. I spent the first 3 months of 2020 in the CNMI. And so I wasn't writing for Civil Beat at that time. And at that time, like throughout that period, I want to say February, but I'm not sure if I'm remembering correctly, the State Department of Business and Economic Development released a report that estimated COFA migrants or Micronesians, I'm not sure how they framed it, but their tax contributions to the state. And it was really interesting. I wish I want to say the number, but I don't want to misstate it. So it's a report that, because I kind of didn't find it until many months later, I didn't, do a story about it saying, hey, there's this new report, because it wasn't new anymore. But I do think that, I think it's something that I have referenced in a couple of articles since, where I would link to it. And so there is some of that information out there. And I can't remember if it was actually like the taxes paid. I think it was estimates of the GDP that they generated. But I think that Keola's right that that's usually not part of the political conversation. I think that's what led to the Ige administration's decision to move people off of MedQuest and onto Obamacare. Was the focus of the of the political conversation was on the amount of money that this community was costing the state. And and not as much focus on, what they were generating for the state.
I've gone through the questions. If any attendees have more questions, please put them in there. But I wanted to ask you, sort of taking away from the journalism that you've done and reflecting maybe on your career a little bit more. I know that you've published in some high profile national newspapers, the Guardian and ProPublica, I believe, or Civil Beat has published with ProPublica. And just wondering, like, how have you felt highlighting these issues has been received at a national level? And do you feel like there needs to be more support to highlighting these issues?
That's a good question. There have been a couple articles I've written that have gotten some traction, like internationally. So for example, when I wrote the story about called Being Micronesian in Hawaii Means Lots of Online Hate, that I was invited to speak on an Al Jazeera panel, and the article was kind of inspired other articles in The Guardian, and I think Radio New Zealand did something. And so there seemed to be some broader interest. That one actually really did gain a lot of traction, but more internationally than nationally. I did see that the New York Times had written there was a piece in the New York Times about race in Hawaii, and they cited discrimination against Micronesians, and I thought that was interesting. And I kind of wondered if they had seen the article, but I don't know if they did. I don't know. I feel like one of the studies I noted was a 2015 study from Justin Levinson at UH Law School, where he was talking about implicit bias negative implicit bias against Micronesians in Hawaii, and how it's not as strong for people who are who are new residents to the state or who are not from here. And so I think that the conversation about discrimination is a little bit different on the mainland, because and also then the conversation about access to healthcare, because there are some states where I think that some states don't extend Medicaid as far as Hawaii does. And so there are far more groups of people who had not had access to Medicaid. And I think that the Micronesians, of course, still experience stigma in different places, but I often hear stories about people experiencing stigma because they're perceived as Mexican or perceived as another group that is stigmatized, and not so much because they as a community are stigmatized. So it's kind of writing about all of this, I think, it's sort of different at the national level. But there was a really interesting article in Politico about access to Medicaid for the Marshallese community in particular. And it focused on the Marshallese community in Arkansas and Iowa. And I know that a lot of Congress members saw that before they voted to restore Medicaid. So I do think at the national level that there is an interest in these communities, and there is an interest in these stories. They just might need to be kind of framed differently or written in a way that's more understandable for people there if they, just aren't familiar with the communities.
Right. It seems like you might not have a counterpart in many other states looking at these issues. So it's good that you're here, and we appreciate your work. I have a couple of other questions coming through, but first I think Julie Walsh followed up on what she had wrote earlier. FYI, one of the authors on the March 2019 report of the Hawaii Advisory Committee to the U.S. Commission on Civil Rights, Micronesians in Hawaii Migrant Group Faces Barrier to Equal Opportunity, is Vernon Char, the father of Dr. Libby Char. So interesting anecdotes to add. a question, do you think there was a link between the pandemic and the restoration of Medicaid access, especially after many years of advocacy on the issue that ran into all sorts of barriers? Do you think your or other reporting contributed to that huge policy change for COFA communities?
I think the political article I just cited did more because it, is a national publication, and I think that was probably more impactful. Although I know the reporter who wrote that, and he said that he learned from my reporting, so maybe indirectly I contributed. I think my reporting has focused more on the decisions of state officials, just because Civil Beat is a local news organization, and I know that has been frustrated for some officials because they wouldn't be in that situation of making the decision of whether or not to maintain MedQuest eligibility for this community if it weren't for the federal government's decision to revoke Medicaid access. But I always kind of felt that I needed to write about state level officials and local officials' decisions in relationship to this community, and focus on that more so than the congressional fight, just because of the type of news organization that we are. But so I don't really know what kind of moved the needle for that, but I do think that it was a bipartisan effort in the House. Like, for example, in Arkansas, I know that Marshallese advocates have, really gotten to know some Republican leaders, and the sort of the advocacy that happens on the mainland is not has been happening on different local levels in different states across different parties. And so I think that the questioner was right, that it's really due to years and years of advocacy kind of all coming to a head.
Okay, this might be our final question, unless any more come in. One of the issues seems to be that the state of Hawaii Office of Language Access has very limited enforcement power around language access deficiencies. Are there models from other states / municipalities with more teeth?
That's a really good question, and unfortunately, I don't know the answer to that, but that's worth looking into. So thank you for raising that.
Yeah. Okay, we're almost on time. Thank you for joining us, Anita. This was great. This is really like the work that you do, and shining a light on these issues that are so important. And for those on the call, next week we will be Rachel Dax from UH West Oahu, and so we'll see you here next week. Thank you.
Thank you so much for having me. And thank you to everybody who came.
All right. A lot of thanks in the chat. So, all right. Take care. Bye.